Hannah. Lovely to
Hello.
have you.
Yeah, it's nice
Thanks
to be
for
here.
joining me today.
No, you're welcome.
So, I wanted to introduce you to everyone on MediTravel and on Endometriosis Egypt because your story is absolutely amazing when it
Thank
comes
you.
to how you were diagnosed with endometriosis, how you've lived with it. The advice and the insights that you've told me are all amazing, and I really want everyone to hear it.
Awesome.
So, give us a brief introduction about yourself. Feel free to mention whatever or not mention whatever.
Okay, no, that's fine. So I'm Hannah. I was diagnosed with endometriosis when I was 32. I had no idea prior to that what it was, that I even had it. There's definitely been things since I've been diagnosed with it that I can link to the endometriosis, but other than that, I had just had absolutely no idea about it. For me, I started having periods around the age of about 11. I had no symptoms of endometriosis. And then everything was fairly normal. But then when I was 16, I chose to go on the pill.
Mhm.
And then about when I was 17, I started to have my first symptoms of endometriosis, kind of the whole, really painful symptoms, throwing up, passing out, that kind of thing. That happened maybe once a year and then progressively throughout my 20s got worse.
Did you see a GP at the time when when that first started
So
to happen?
I didn't actually go to see a GP just purely because I thought this was normal. I thought it was normal to be lying, on your kitchen floor and, almost passing out or not being able to move. I just thought that was a normal thing that came along with having a period. So I didn't see anybody really until I was maybe at the end of my 20s. And when I did go and said that I'd had these symptoms, they just changed my pill. But actually, that was a positive thing for me because I was put onto the mini pill, which then made all of my symptoms subside. So that was a really good thing for me. However, when I hit kind of 31, I ended up having some side effects from that pill, which then led me to be referred to a gynecologist. And then that was when it was found that I had endometriosis. So through the test of that.
So you said from the age of 17, you started having very painful periods.
Yeah.
And up until the age of 21 or 31?
32, 31.
31, you
Yeah.
hadn't seen a gynecologist
No.
because no GP thought it was worth referring you
I
to
think I
gynecologist.
think it was more so the fact that I hadn't gone to a GP and explained these symptoms. When I was 28, I went to see a nurse and I explained that whether I was on the pill or whether I was off the pill,
Mhm.
I had all these symptoms around my period because my symptoms were mostly just related to my period. They weren't throughout the month.
Mhm.
So I went to her, I explained, I have these symptoms, whether I'm on the pill, whether I'm off the pill. And she just said to me, oh, we'll try a different pill. So it was that hormonal approach. And so I started taking that pill. All my symptoms went away. So I just didn't really think anything of it until I started having side effects. And it was then when I went back to my GP and said, well, I don't know what these symptoms are linked to, that she then referred me to a gynecologist.
So you hadn't had an ultrasound at any point up
No,
until
no tests whatsoever until was first referred to a gynecologist. They then sent me so the first round of tests, I had an ultrasound. I also had a blood test for a CA125, my CA125 levels.
yeah.
And then the ultrasound actually came back saying that I had some ovarian cysts. But they thought that those were linked to my cycle. They didn't think they were linked to endometriosis. So they then said that they were going to redo the test, but with an internal scan. And it was when I had the internal scan that they found the endometriosis.
They saw cysts, but they didn't think it was endometriosis.
No. And they thought the cysts were linked to my cycle. And when they did the ultrasound the second time, they actually showed that they had reduced. The second ultrasound showed it had reduced.
They just reduced in size.
They
That's
just
all.
reduced in size. So
They
they
didn't
assumed,
know whether they were blood filled or just.
no idea. They just assumed that they were linked to my cycle.
So what happened from there?
So I had the internal ultrasound and the report showed that I had endometriosis. So then I was officially given a diagnosis of endometriosis by the gynecologist. But what I was told was that because I wasn't really following a path of fertility, it was probably best to leave the endometriosis alone until I maybe chose to have children in the future and then maybe look at seeking to have a laparoscopy.
So they knew you had endometriosis.
They knew I had endometriosis.
You were symptomatic.
So no, because at this point I was still on the pill.
All right.
So even though I was having some side effects, they were really minimal. So it was mostly kind of like some bleeding out. So I wasn't having a period. It was mostly just spotting all the time. That was the main symptom that I was having. And I kept taking that pill up until I had further tests because they obviously realized that the symptoms I was having weren't linked to the endometriosis. It was obviously something else going on.
Mhm.
So I had a colposcopy and they diagnosed me then with an ectropion, which is a group of cells that form on your cervix, and they just cause bleeding all the time. But I was discharged from the hospital, and without any advice as to what was causing the ectropion. And then I then got referred to a different gynecologist because my doctor didn't know what was causing that ectropion, didn't know it was hormonal. So I was then referred to a new gynecologist who immediately suggested it was hormonal. But because I had been given this diagnosis of endometriosis,
Mhm.
she suggested I switched from the mini pill to the combined pill,
Hmm.
which I had already been taking previously. I explained that it was, regardless of me being on that pill or off that pill, my periods were awful.
Yeah.
But they suggested I try it anyway. I did try it for 3 months.
Mm.
But nothing really came of it. My periods were back to being awful. And then so I decided to stop taking that. But at the same time of seeing them, this was a different hospital. I had some scans done with them and they said that they found no evidence of endometriosis. So I was back to square one, really. So from that point,
Did you not already have a diagnosis
so I
of
had a
endometriosis?
diagnosis, but then I went with one hospital. Well, then I went to another hospital under a different trust and they said that they'd found no endometriosis. Yeah. And then I had like maybe a year and a half break of no pill, no hormones, just dealing with my symptoms on a daily basis. And then they started to get progressively worse. So I went back to the GP, and the first thing they did was refer me to have more scans done. And when I had the third set of scans done, they said that they were correlatory with the other scans that I had done previously, which both showed endometriosis.
Surprise,
And
surprise.
yeah, so they both showed endometriosis. And then that was when they kind of then started to suggest that I had a laparoscopy so I could have, you know, and even though they had the diagnosis of endometriosis through the scans, they wanted to give me a laparoscopy to give me an official diagnosis and take some biopsies to make sure that it was officially endometriosis and nothing more sinister. From there, I had an MRI and then I had a diagnostic laparoscopy in February 2021, which confirmed I had stage 4 endometriosis.
And did they excise anything in this diagnostic
No.
laparoscopy?
So it was 20 minutes long. They just took the biopsies to prove that it was to send off for laboratory testing to prove that it was endometriosis.
Did they take photos?
No surgical photos, nothing. So
It was
which
just to
it was
send
just,
off to
yeah,
pathology and
just
confirm
to
that you have
confirm that I
endometriosis.
have endometriosis, which I obviously know now. I wish I'd have done the research that I have done since then, because I absolutely would not have had that laparoscopy. I would have really pushed myself because I was also seeing a general gynecologist.
Yeah.
And now I know that really you need to see somebody that is an endometriosis specialist.
Absolutely. And what made them change their approach from we're not going to treat you because you're not seeking fertility to you should have a laparoscopy?
I think it was because they'd found it on the scan. They knew it was infiltrating. My bowel was, is stuck to the back of my uterus. So they knew that the endometriosis was infiltrating through to other areas where it shouldn't be. Also, my blood results, like my CA125 level, was really high. And I think what they were concerned with, because that's also a measure for ovarian cancer,
Yeah.
they were concerned that it could be something more sinister. So that was why they did the diagnostic laparoscopy, because they wanted to rule out anything else.
They informed you of this before the surgery?
Yeah, they informed me of this before the surgery.
It must have been awful, like saying, oh, by the way, there is a chance you might have ovarian cancer.
Yeah,
We don't know,
no.
but you may have it.
So there's certain things that really stick in my brain. So I've been in the system for a really long time now, or it feels like a really long time anyway. And there's certain moments that stick into my brain. And that's one of the things where, when the consultant is sliding a Macmillan card across the table to you and saying, these are our Macmillan nurses, it's quite scary. And also to come home and then have people asking you, what happened at your appointment and to say, doctors think I might have cancer, they don't know. But ultimately, I was never concerned about that because I'd done a little bit of research and knew that CA125 markers, if you have
Yeah,
endometriosis, are high
tends to
anyway.
be higher.
So, and I already had, two people saying I had endometriosis. So, whilst yes, it could have been something else, I was pretty sure that that's what they were going to come out with anyway.
It's really important that patients are informed.
Yeah,
People actually know what.
yeah. It's still really scary for it. Yeah, yeah, okay, it's scary, but I think if you're informed, I mean, that's the whole thing for me. I didn't realize when I started this how much I needed to advocate for myself and how important it was to do my own research.
Yeah.
You know, so and it makes moments like that less scary
Mhm.
because if I hadn't have known that CA125 tests were, if they were high and elevated, it was also a marker of endometriosis, I would have been really scared at that time. So,
How would you describe the journey from that diagnostic laparoscopy? Did things go well after that and you actually found the care you
mm.
needed? Did you struggle to reach a
Ah.
specialist? How did things go
So,
after?
so it was a long journey. So after the diagnostic laparoscopy, um, nothing really changed. Things didn't, my periods didn't improve. They didn't really get any worse until October 2021. And I was hospitalized with a kidney infection. And then from then, things seemed to get a whole lot worse. And I don't know what the correlation was from that, but it just, my symptoms seemed to get worse. And my pain wasn't then cyclical, it was constant throughout the month. I was constantly taking painkillers. I'd have really bad fatigue
Up until the diagnostic laparoscopy, your pain was just during your period.
just during my period. Yeah. And then I'd have maybe a few like bowel related symptoms with that. But it was never outside of my period. And then
Even though
after,
you had deep infiltrating
even though I had deep
endometriosis.
infiltrating endometriosis, and if I could go back now, I would dismiss that. I would not have that diagnostic laparoscopy because it was just a box checking exercise. For me, it was that, okay, well, you have endometriosis. Yes, okay, it made sure I had nothing more sinister underlying, but it definitely made my symptoms worse. And hindsight is great because I can go back now and look at my symptoms and think, oh, actually, they weren't really that bad. But obviously, you don't know what you're going into, until you've done it. So
What happened after you had a kidney infection?
so I had the kidney infection. I had some more tests done, which again revealed that it was the endometriosis that was affecting my kidneys. And at this point, I had been referred to a couple of groups on Facebook. I'd done a lot more research, and it made me realize that I needed to find a specialist because the hospital that I was under, they didn't have a specialist there. They weren't really going to give me the care that I needed because they weren't able to. And that was what led me to do my own research online. And it was also what led me to find Mr. Morsi when he was operating under the NHS in the UK. So I went to my GP, I asked for a referral in February 2022 with him. I had an MRI in the July of that year. And then in around the August time, I had the same kind of symptoms that I'd had the previous October with the kidney infection. So I went straight to the hospital. And then within 24 hours, they were fitting me with bilateral ureter stents because the endometriosis was pressing on my ureters and it was preventing my kidneys from emptying into my bladder. And it was also really helpful because at that point, the hospital had gotten the MRI results back.
Mhm.
So obviously, they were able to see the extent of the endometriosis on the MRI as well.
It's still shocking that some people say endometriosis can't affect the kidneys.
Yeah, absolutely. So I have lost a kidney to this, and I also didn't realize how important it is to, endometriosis is not just a disease of the uterus. It will affect everything else around it. And it's important to monitor those other areas as well. So, obviously you can have hydronephrosis of the kidneys, which is where obviously if they can't empty properly, your kidneys will swell. And then I think ultimately, that's what caused me to lose the function because on my left hand side, the endometriosis was compressing it closed so much that just eventually my kidney gave up. So,
up until you had that kidney infection, did you have any idea your endometriosis was affecting bladder or kidneys?
So I did. So in my early 20s, I had a lot of UTIs, which I now think were related to the endometriosis. But I think that that is potentially when it was probably most active. And then the older I got, this is just my belief, the older I got, the more it was becoming settled. So I'd maybe get a UTI probably once or twice a year. But in my early 20s, they were at least once a month.
And even though you complained of that and you complained of really painful periods, no one suspected
But
this.
I think they weren't correlated because they were at different times. So I think
Oh,
I
so they
think
weren't cyclical.
so there was no, or maybe they were, but I never
You never,
logged it.
yeah,
And I think that's really important. Like if you think you have endometriosis, start logging your symptoms. That's the main thing.
absolutely, yeah.
It's a really important thing if you think you have it to start logging your symptoms. Log, how often it occurs, when in your cycle it occurs, because then you can see the correlation between the two.
And how did your surgery with Mr. Morsi go, and what was the outcome of it?
So it was amazing. So I had the bilateral urostents fitted in the early August, and then in the September 2022, that was when I had my surgery with him. So the surgery was quite extensive. It was 9.5 hours long. I ended up with an ileostomy. So I had a stoma. I also had a bowel resection. Um, but pretty much from that operation, I have been almost completely pain free, which is just crazy to me. I remember going into his office to discuss my consent before the operation. And I remember, kind of describing it felt like there was a rope around my, where my kind of leg joins my hip area, and that somebody was pulling really tight. And it was almost as if once I'd had that operation, all of that had gone. The other thing I will say is my left ovary I had that removed. So I also potentially think that was causing some of the pain. But also, my intestines and my bowels were stuck to a lot of other things. So I think perhaps relieving some of that relieved a lot of the pain as well.
That's
So
amazing that the
yeah,
surgery, you sort of saw like almost an immediate effect.
yeah, definitely. And, even so after that, I was put onto medication to stop me having any periods. And then when when I stopped taking that medication, the first period that I had no pain, which is absolutely insane to me. I'm sure that anybody that has endometriosis knows what it's like previously to even go from not being able to get out of bed for like 2 days to not knowing it was arriving is just a crazy thing. Like I still can't wrap my head around it.
I think
Still,
that's the reason why excision is the gold
yeah,
standard.
yeah,
Is
for
honestly,
sure,
for me as
definitely.
well, was the only thing that had proper long term
Yeah,
positive
yeah,
effects.
definitely. So it's been almost 2 years since I had that surgery. And like for me personally, it's something that I know everybody needs to think about and take
Yeah.
their own path. But I would never recommend going with a general gynecologist. I would always recommend an endometriosis specialist because of the difference between the two. So even though I had an extensive surgery with Mr. Morsi, the recovery was so much easier and swifter than the recovery from the diagnostic laparoscopy.
You said that you went to the GP and asked to be referred to Mr. Morsi.
Yeah.
Is this something, how would you advise someone who is beginning their journey of diagnosis and they sort of don't know where to go? How do they advocate for themselves? And how do they know who to ask to be referred to?
So I think there's a lot to learn
Mm.
about endometriosis. So I would just recommend start doing your research. There's really great information out there. There's a lot of people on Instagram. I mean, obviously yourself, I found you through through Instagram, and there's so many people as well that you can recommend that are, bringing more awareness of endometriosis. So I would probably say start following other people. They can probably help and help you to learn initially. But then going back to who do you get referred to? Obviously, I personally would look at a BSG website to find a dedicated endometriosis specialist. I'd also look at I Care Better, the site, because then you can look at surgeons' reviews as well.
Yeah.
I've actually found Mr. Morsi through a group called Nancy's Nook. You can Facebook search surgeons and see
Yeah.
other patients' reviews on Facebook. So, and a lot of surgeons now have a Facebook page themselves. So that's really helpful because they will have previous patients reviewing them, which is crazy to think, but I think that's the world that we live in.
Yeah, but it's really good that you were able to sort of say, "I want to go to this doctor."
Yeah,
We have a problem in Wales that you can't do that.
yeah,
So
yeah,
I didn't actually know that existed.
yeah,
That's called the NHS right to choose?
yeah, yeah,
Yeah.
that's correct. Patient's choice as well. That's what they call it.
Yeah.
So that's really
Yeah,
important.
so it's really important people are aware of that, I
Yeah, for
think,
sure.
because especially with younger people, honestly clueless on, "Okay, I went to the GP and the GP didn't refer me, so
Yeah,
I must be okay."
yeah.
That sort of thing needs to be sort of abolished.
Yeah, and I think as well, it's really important to maybe I know everybody's circumstances are going to be different, but Mr. Morty wasn't local to us, so we were traveling over an hour each way to do those hospital appointments. And I think you maybe might have to just look outside of your area and look at who is the best person for you. You know, not only just are they local to me, are they going to be the best fit for you as a surgeon? You
Mhm.
know, what are their skill set? Also, who do they work with? Do they work with a urologist? Do they work with a colorectal surgeon? Because it might not necessarily be that you just need the endometriosis specialist. You need a specialist team working under them as well. And it's also really important to investigate those people because, for example, I had an ileostomy. It was also really important to know, well, okay, does the surgeon work closely with Mr. Morsi? Does he do bowel resections on a regular basis? And, I'm sure that these are things that are quite common in a hospital,
Yeah,
but it's also good to put your own mind at rest and know that you are under a team of really solid
absolutely.
surgeons.
And what happened after your surgery with, Mr. Morsi?
So after my surgery with Mr. Morsi, I was still under the urology department for just to because I still had the stents in, and there was still an issue there with a part of my surgery that couldn't be completed
Mm.
during my main excision surgery. So there's a nodule of endometriosis that's on my bladder, and it is blocking my right ureter. And so I was still under urology because I had the surgery with Mr. Morsi prior to him going on leave to Egypt. So going back to Egypt. So and I knew that prior to undertaking the surgery with him that he would be going on leave. So I was still under the urology department. I had my stents changed, and then I got something didn't feel right. So I went to my GP. They diagnosed me with an infection. I had a round of oral antibiotics. Still had the infection. Had another round of a different oral antibiotic, and then with my urine sample, it came back that the only other antibiotic that would work was one that was administered via IV. So I went to the hospital and it turned out that my kidney function was really low. So it was at the point of, that was when they started to do the investigations. And then that was when they found out that I'd only got one kidney that was functioning. So what had happened prior to that, when I had my excision surgery, for some reason, my kidney function had elevated. So it looked like both kidneys were working, which then makes it seem as if, obviously, if you're thinking that the endometriosis is causing the compression on the kidneys, and then you do surgery, and then the EGFR is elevated, then obviously you'll think that the surgery's done the job. But then unfortunately, it just wasn't the case. And so when I went back in the following March and my EGFR was monitored, it was basically half of what it should be. So to counteract that, I then had my bilateral ureter stents removed, and I had a nephrostomy inserted, which is a tube that goes from your back straight into your kidney, and then it just drains out through that way.
In the surgery, they thought your kidneys were fine in
Yeah,
your excision surgery, and after the surgery, you were pretty much pain-free
pretty much pain free. Yeah.
for quite a few
Yeah,
months.
so a
You
few
know,
months, and I was still really pain free. It was just when I had my stents exchanged in the January,
mhm.
that's kind of seemed to stir up this infection, and I was still, really, I just had pain from the infection, so I didn't think anything of it. I never had any pain that would indicate that, my kidney had stopped its function at all. No
It was
pain.
kind of found
It was
out
just kind of found out
by
because
coincidence.
it was so yeah, I mean, it was found out because I had a blood test to measure my EGFR, which is my kidney function to show, and that was showing it was low. And then the only reason I went to A&E was because I'd gone through both sets of oral antibiotics, and the other antibiotic on the list was an IV antibiotic. So I knew I had to go to hospital to have that administered, which is crazy. It's crazy.
Was this was a year after your surgery?
So that was the March 2023. So it was, yeah, so it was about 6 months after my surgery.
Although you had no symptoms really.
No.
This is the thing with endometriosis, it keeps you like, keeps you on your feet.
Yeah. Yeah. And also as well, you think, oh, I've gotten out and I'm playing, it's real plain sailing. And then something else will come and, sideline you. And you just think, oh, I mean, for me, I'm still really fairly asymptomatic, but the one thing for me is, I've obviously had some recent MRIs that show that my insides are still, not amazing. So it's great that I'm asymptomatic, but it's always, you always unfortunately do have to be aware that it is a progressive condition
Yeah.
and that, you
It's
need
really
to keep on
important to
top
keep
of it. Yeah,
monitoring it.
you need to keep on top of it.
How did you end up getting scans in Egypt? Out of all places.
So I started to progress. Obviously, so Mr. Morsi obviously unfortunately didn't come back to the NHS, and it then led me to start looking for another hospital to complete the remainder of my surgery. And so I had my initial consultation with them. I had a cystoscopy, which is a camera into your bladder, just for them to see where this nodule was and how it was and that kind of thing. And then in March, they decided to remove my non-functioning kidney, which it needed to come out anyway. So it wasn't really a thing. They needed to remove that. So, and then I really want to get the remaining part of my surgery done. So by reimplanting my right ureter, it will then mean that I can have the nephrostomy tube removed and I can kind of then carry on living normally,
Yeah.
if that's a thing. Because with the nephrostomy tube, I'm unable to like take baths or go swimming, or I'm really conscious of just, getting anything into the area, into the wound. And, like I'd love to sit on a beach, but I'm conscious of there being sand and things like that. So,
Yeah.
little things like that. So I want to get rid of the nephrostomy tube. And when it came to the removing my kidney, it then meant that it was a potential wait of a minimum of 6 months before I'd have this next stage of surgery. So then it led me to find Mr. Morsi and I was looking into seeing whether he was taking on private patients. And then I saw the interview that you did with him. And I really liked the way that you conducted yourself, the way he was. So I started following all your channels. And then it's really great to see what you were doing with Endometriosis Egypt. And that was how I booked my MRI with you, because I wanted to pursue surgery with him privately and see whether that would be an option. And I would highly recommend going to Egypt for scans for anybody. Just the whole process was great. So it was really good because everything was really quick. So I think I contacted you maybe 2 weeks before I took the trip. I did the scans on the Saturday. The results were back by the following Wednesday. The care was amazing. Like I really couldn't fault it. And it's definitely something that I would recommend to everybody else. It's also great in that there was no medical anxiety that came with it because everything was done so quick. So what I find here is perhaps something will be done. It might be a few weeks before you get results. And there's all that tension whilst you're waiting as well.
And it's easy to access specialists as well.
Yeah. I couldn't believe how easy it was and how easy it was. I mean, I say it's easy, but you made it seem easy to arrange as well. So whilst I was in Egypt, I needed an extra blood test and that was just so simple. It was a case of, okay, well, we've done the MRI, we've done the CT scan. We're concerned because you only have one kidney and it's, we know that we want to make sure that the function of it's okay. So we're just going to do a repeat blood test just to check that everything's okay. And to me, that was crazy because, it's just going those extra steps to make sure that everything is okay.
Yeah. I mean, being put in that position myself, like just struggling to get a single blood test.
Yeah.
It was a bit of a shock.
So if I have to have a blood test here and I book it, I have to wait probably about 2 to 3 weeks before it comes through. So it's crazy that you can just go and
we can arrange this stuff within.
Yeah, which is just crazy to me.
And the MRI as well. Like the thing is with MRIs, they say they don't detect endometriosis, but it's really operator dependent? Who's writing the report?
That's literally
That's
what
a
I was
key
going to
question.
say. That's exactly what I was going to say. It is really operator dependent. And so at this point, I've had three MRIs, all for endometriosis. The first report with the general gynecologist and the two that I've had since are completely different. So the first one I've had with the hospital where they did nothing really for my endometriosis. It's probably like a couple of lines. It doesn't really indicate that there is any endometriosis on my MRI. And then I've obviously had the one with the NHS hospital here, and also your one in Egypt. In actual fact, the MRI that I had in Egypt had the most comprehensive report for it. So it had the most comprehensive report with imaging as well, which is really great for me to see. So sometimes when you get a report, it's quite lengthy and it's difficult to maybe imagine how that correlates to your body.
Yeah.
Whereas when I had the report from my MRI in Egypt, there were physical pictures with, things highlighted and, arrows just pointing to the report. So you could see which paragraph linked to the image. So that was really great as well. And it was great because if there was anything that I didn't understand on the MRI, I could also then go and Google it and look it up and then it's important then because you then become more informed as a patient. So you can bring this up with your specialist and say, okay, well, the MRI suggested this. I don't understand it, or I understand it, but I don't understand how it links to my endometriosis.
Yeah.
So, and you can have that conversation with your consultant as
And a
well.
lot of people have this misconception maybe that if you get a scan done abroad, the NHS is not going to accept it.
Yeah, that's
Was
not
that your
true.
experience?
No, it's not true at all. So once I'd got my imaging and my CDs back from Egypt, I just sent them to my consultant here, and we just made copies, and they accepted them, and they were fine.
That's
So
amazing. And
yeah.
did they find that this helped them prepare for your next surgery
Yeah, they
then?
did. So they actually found that my endometriosis had progressed from the MRI that I had done. So I moved to my new hospital in July of last year, and then I had an MRI in August, and then I had of last year, and then I had the MRI done in Egypt May this year, and they found that during that time the endometriosis had progressed. So it then meant that they've now had to find other surgeons to be part of their team to deal with other parts of the endometriosis as well.
At any point in your journey, did a doctor tell you that you need to monitor this every 6 months or every 3 months?
No, not at all. Not at all. Which is just,
It's
it's
just something that,
crazy. And I think that's really important. Like going forward, even if I'm discharged from an NHS hospital, I would probably still consider maybe coming to Egypt every so often, even if it's just once a year, to have a follow-up MRI. And the other thing that I found really, that was interesting to me was the fact that the cost of going to Egypt was actually the equivalent of the cost of having a private scan on the NHS.
you
So
mean you mean the entire
the
trip?
entire trip. So that was like 5 days accommodation, the scans. So obviously the scans were a really small portion of it. So the cost, so there was 5 days of accommodation, flights for me and my partner. There was our spending money included in that, and a couple of little trips as well. And that cost us the same amount as it would have just for the scans on the NHS.
You mean just for the scans privately?
Yeah, just for the scans privately.
Yeah.
Sorry. Yeah.
Yeah. And on the NHS, you would have had to wait quite a long time to get them.
Yeah.
I certainly do this as well. I go to
Yeah.
Egypt whenever I need an MRI or anything.
Yeah. I think even if I had needed an MRI that wasn't related to endometriosis, I would probably just go and have it. And I think as well, the level of care was great when I went to Egypt, obviously the doctors and nurses there were aware that I only had one functioning kidney. And that was really high on their list of priorities to make sure that everything that they did was, to preserve the function of that kidney, with the CT scan. Obviously, they use a contrast dye, which can be slightly detrimental. So they used a newer version of that dye to make sure that it was preserved. Apparently, the older dye is more detrimental, but the newer dye, I can't explain it. And it's but it actually helped as well. So obviously having our translator there who had worked in the pharmaceutical company. So whilst I was having my CT scan, they were actually looking at the dye that was used in my scans. And that was a great help just to have everybody like on board and kind of
Informed and
informed and helping with my medical care. It's like those little things that really, really helped with my trip as well.
no, I'm really glad to
No,
hear
no,
it was
that's
a good
fine.
trip as
Yeah,
well.
yeah.
What would be your overall advice to someone with endometriosis just in the beginning of their journey?
Do your research. Absolutely research everything. It can be really overwhelming. Like, it can be really overwhelming. That's the main thing. And you can read some scary things. And I think my story can be quite scary to people too, as well. You know, the fact that I've had an ileostomy, that's now being reversed as well. That's the other thing. So I know there's a lot of people out there that are concerned about having a stoma. But that's the other thing, they can be reversed. And the other thing as well, you know, with me losing a kidney, obviously those things are really quite scary. But I feel by doing my research and being informed, it helps me go to appointments and I get the most out of my appointment by knowing, you know, what's going on and what things I need to measure. Okay, well, how do I know my kidneys function is low? You know, what blood things do I need to know about
Mhm.
and indicate, you know, markers do I need to be aware of as well?
I
It,
still hear a lot of doctors say, it's not symptomatic, it's not a problem. What would you respond to this or how would you explain this?
I mean, that's definitely not true. And also with endometriosis as well, it might be that something is symptomatic. Like for me, you know, my bladder was symptomatic in my early 20s. And then the older I got, the less symptomatic it become. So just because it's been symptomatic, you know, it's not symptomatic now, it doesn't mean to say that it hasn't been previously. And it also means that just because it's not symptomatic now, it's okay. Because my bladder wasn't symptomatic and then I ended up losing a kidney. So crazy.
I know, it really is. But your advice is amazing and your story is inspirational. And it honestly raises so many good points about just because it's not symptomatic doesn't mean
Yeah.
it's not a problem.
Yeah.
You need to monitor yourself, get that yearly MRI.
Yeah, for sure.
Like it's just,
You need to really monitor yourself
yeah, it is a
and
progressive
push for it
disease.
as well. This is the thing. You really have to fight and push for things to happen
And know who to
because
go to.
and know who to go to. And because nobody else is going to fight this for you, you have to fight for yourself. That's the main thing. And that can be really hard when you're dealing with endometriosis symptoms daily. That can be super hard as well.
Yeah. Yeah. It's not just cyclical as well.
No,
For
yeah.
most people, really it isn't.
Yeah.
But they still treat it like a period problem.
Yeah, yeah. Yeah, for sure.
Hopefully, conversations like these and, you know, efforts of raising awareness,
Yeah, exactly.
all of that hopefully can move things in the right direction.
And I think open conversations are really important because when I first started having periods, I wouldn't tell anybody, I wouldn't talk to people about my periods.
Yeah.
And I think the older I've got, the less I care. But if I'd have actually started talking to people maybe as a teenager, I would have realized that what I was experiencing wasn't normal and not everybody goes through that. Because the other thing is endometriosis can be genetic. So if the people you're going to about your periods, maybe like your mom or your grandma or an aunt, and they have endometriosis, but
They don't know it.
they don't know it. They're just going to turn around and say, "Oh, well, we're the same." Well, of course you're going to be the same because you potentially have the same condition. So
Yeah.
it's really important to kind of maybe speak to other people.
And break that cycle of lack of awareness.
Exactly. And the other thing is, you know, Google is great. If you don't want to talk to people, you can just Google it as well. That's the thing. You have to be careful of Dr. Google, but
The thing is with Google, because for me, I also spent 12 years undiagnosed. I was looking at the symptoms and I was thinking, that's a huge list of symptoms. And I only have like two,
yeah,
one of which is the painful periods.
yeah,
Surely I don't have that.
yeah.
But that's not the case.
No, no.
It should like say at the top, you don't have to have all of the symptoms to suspect you
Yeah,
have
most
endometriosis.
definitely, most definitely. And the thing that I find really crazy as well is that, you know, I'm stage 4, yet my symptoms now are really minimal. But then you have somebody that's stage 1 or stage 2 who's in chronic pain all the time.
Yours truly.
So, yeah, yeah, exactly. So, and you know, that's one of the thing that's crazy to me.
strange
And it's you know, it's also the fact that it's not the same condition. Even if we both have endometriosis, we both have totally different stories, totally different symptoms. It's not the
Yeah.
same for every person.
Yeah. And so we've heard theories about people saying it's different types of endometriosis.
That really blew my mind.
That
I
was
mean,
really
I thought I
interesting.
knew a lot of stuff about endometriosis, but that was something I only heard recently, and that makes total sense. But also that idea, because we know that it's found not only in the uterus, it's on the bladder, the bowels, the brain, the heart. I mean, you did
The
the
lungs,
lungs, the eyes, you did
the
an
eyes, yeah,
interview
yeah.
about that, so it's everywhere. But the idea that there's different types, I definitely love for there to be a lot more
Research,
research into it,
yeah.
and for there to be a lot more treatments for people, not just surgical, but also maybe not even hormonal, but something along that line.
Something a bit more than a Band-Aid solution.
Yeah, exactly, exactly.
Yeah. Thank you so much, Hannah.
No, you're
Incredible
welcome.
story. Thank you
No,
so
and
much.
thank you for coordinating my trip to Egypt. It was
It
amazing.
was my pleasure.
No, thank you so much.
Ciao.